So, of course, I need to comment on the recent claims regarding autism and acetaminophen or Tylenol use during pregnancy. Hi, I'm Becca. I'm a PhD student studying the effects of prenatal cannabis or THC exposure on brain development. Now, as a disclaimer, I am a preclinical researcher, meaning I study rats, and the research that this recent claim most concerns has to do with clinical research. I decided to take a look at the article that's at the center of this claim. This article is a review of 46 studies that examine the association between acetaminophen or Tylenol use during pregnancy and neurodevelopmental disorders. Of these 46 studies, 8 of them specifically examined the association with autism. And of these 8 studies, 5 found a positive association. An important confounding variable is the reason that these mothers are taking acetaminophen during pregnancy. Maternal immune activation, that is the activation of the immune system during pregnancy, is a well-established risk factor for the development of autism. And so if these mothers who were taking acetaminophen during pregnancy were taking it because of an infection or fever, this could confound the reported association. Is it the acetaminophen increasing the risk of autism, or is it the infection or fever? And the review article did state that these studies did control for such confounding. But one thing I've learned throughout my academic career is that it's much better to look at the actual primary literature or the primary data. That is the papers that actually contain the studies that were conducted. And so I didn't look at all of the 8 studies, but I did look at a few of them. And I'll just say it is very nuanced. They all did consider this confounding of the reason that mothers were taking acetaminophen. But my main concern is whether they actually have accurate information on this. For example, one study relied on inpatient and outpatient records of diagnoses of fevers and infections during the whole pregnancy period. So it's not like they were collecting specifically the reasons why an individual used acetaminophen at this one time. Even the authors of this study said in their discussion that there are many low-grade fevers and infections that do not warrant medical attention. Therefore, they don't necessarily have the most accurate records of the number of fevers or infections. Another one of the studies I read did sensitivity analyses where they excluded mothers who had a fever and infection during pregnancy to compare that result to the general data, as well as an analysis where they only included mothers with a fever and infection, and they found similar association. But for this particular study, there is a positive association between acetaminophen use during pregnancy and the development of autism in male offspring. However, it is the reverse in the female offspring. So females actually had a reduced risk of developing autism. It's also nuanced, as I hope it's become clear. Different studies do different analyses, they collect data differently, and it makes it very difficult to have strong conclusions or make strong claims without having a lot of data to support. So really, there's just a lot to consider here, and just be wary that almost every claim has a caveat.